You've torn your ACL. A sentence met with devastation.
He's not dying, he's not dead, he's still the same person. So just unfortunately we've, may have lost him for another season.
In Australia, surgery is usually the first answer. A 2018 Medical Journal of Australia study showed 90% of ACL tears are treated by going under the knife. That compares with 50% or less in parts of Europe. But specialist physiotherapist Kieran Richardson is having success taking a different route.
All of the research has been heavily biased towards surgery, so the energy, the emphasis, the costs and the funding has all really been towards surgical techniques and graft types, and this is all culminated in us believing that surgery is necessary. I'm recommending that any patient or athlete that injures their ACL follow world's best practice, which is to undergo an intense, structured, supervised, scientific exercise program. If the player is coping well, then we would continue to build them up, and they can always decide upon having an operation at a later date. If we start with a intense, individually tailored strengthening program, we're going to get superior benefit either way, and I think that's a fantastic news really for society as a whole.
Alex Johnson underwent 5 knee reconstructions since the Sydney Swans premiership in 2012. 2,136 days had passed until his inspirational comeback last year.
You'll hear the siren and this place will erupt. Look at Alex Johnson.
His 6th coming a week later.
Football should not be allowed to be this cruel to one man.
Johnson is currently 5 months into his latest rehab and admits there were times he considered taking a non-surgical approach.
Every surgery I was having was failing pretty much because of the infection. It wasn't a healthy knee at the time, and I went on strong courses of antibiotics for probably 2 years there at a time, and there was probably a time, 2.5 years where I didn't have an ACL. The stats show that a percentage of people can function and live without an ACL, and I was lucky enough to be one of those, I suppose. We threw up the idea, do I have a go at rehabbing it for 3 or 4 months without an ACL, see how it goes and try and play without one. The big thing in professional sport is the time. You just don't have that. If I invested 3 or 4 months into not having an ACL and it didn't go well and then had the surgery, I've sort of wasted those 3 or 4 months. And when I was at a time in my career where I was, fighting for a lifeline to stay on an AFL list, time's pretty precious at those times.
Australia's love for twisting sports like footy and netball has been blamed for the increased rate of rupture, and historically, the most common treatment has been immediate surgery. Dr. Greg Hogan has worked with West Coast for close to 10 years and consulted on both of Nick Nadanui's reconstructions.
With those sports where we know there is little to no chance of them returning without the ACL, it's best undertaken early in the acute phase, and those players then have a sooner return to function. I've had elite rowers and elite cyclists with no ACLs, but it's not a sport that tends to stress that cruciate. They don't have those subluxation pivot events in them. There's very little evidence that anyone's returned to AFL or elite soccer without an effective ACL.
A good number of studies now that are showing if left, the ACL can actually heal, and with complete full thickness tears can reunite, which we didn't know, or the assumption was because of a poorer blood supply that it was impossible. But we're realising that's probably occurring more than we previously thought. So that's the first thing. And certainly if it doesn't reunite, it often can become almost a redundant ligament.
Johnson has taken a player coaching role with Carlton's VFL affiliate, the Northern Blues. Let's hope this is his last rehab, but odds are he's just one of many athletes to go through this in the year to come. Josh Garlip for Fox Sports News.